Thanks for listening to the FU Cancer Podcast. My name is Christina Rollins. I'm a dietitian, mom, and wife to a pretty awesome cancer survivor. We said FU to cancer nearly 25 years ago and are still going strong. I'm excited to share the FU Cancer movement, where we are a community of survivors, fighters, caregivers, and advocates, connecting our shared experiences, passion, and determination to live a holistic and well-balanced life. Stay tuned, because we've got a lot to talk about. Everyone, welcome back to the FU Cancer Podcast. Today we are joined by clinical exercise physiologist Christopher Fitzmaurice, here to talk with us about physical activity and exercise as a prevention and treatment strategy for individuals living with chronic disease, especially those battling cancer. Chris currently works at the Concierge Executive Health Program and is also a group exercise instructor at the University of Miami. He holds certifications through the American College of Sports Medicine as a clinical exercise physiologist and cancer exercise trainer, certified strength and conditioning coach through the National Strength and Conditioning Association, and USA Weightlifting also as a coach. In addition, he holds certifications through the American Council on Exercise as a health coach and group health instructor. Prior to his current role in Miami, he also worked for 5 years in a comprehensive cancer center providing exercise physiology services to cancer patients. Chris is currently completing his second master's degree in the Prevention Science and Community Health Program within the Public Health Sciences Department at the University of Miami, and will actually begin his third master's in leadership in the fall of 2025 through Miami Herbert School of Business. He obtained his Bachelor of Science degree in exercise science and a Master of Science degree in clinical exercise physiology, both at the University of North Carolina at Charlotte, and he aspires to one day earn a doctoral degree. So honestly, I feel like my morning exercise routine was simply reading Chris's bio because he brings so many amazing accolades to this podcast. So Chris, thank you so much for joining us today.
Absolutely. It's great to be on here. Thanks again.
So tell us about exercise as medicine and why we're seeing this sort of shift in mentality that treats physical activity less like a recommendation and more like a prescription.
Yeah, no, that's a great question. I'll tell you this. If we knew what we knew now, like if we knew what we did, if we knew what we knew 30 years ago, what we knew now 30 years ago, we would be off to such an incredible head start as far as just having a really deep understanding what exercise and physical activity can do for our cancer survivors. And one of the big things is we're understanding that different types of exercise and different types of physical activity have different responses or different effects for cancer survivors. You know, um, you know, back 20 or 30 years ago, most of the time, if exercise was an option, most clinicians or a doctor would tell, a patient of theirs to, go for a walk, or do light activity. But one of the great things is we are understanding that even vigorous exercise in the appropriate amount can actually produce substantial effects for them as well. And the thing is, the exercise plans and prescriptions that we're getting better and better in terms of understanding, they're becoming more granular for not just for the general population, but even for our cancer survivors. So they're getting more dose specific, and with those specific recommendations, we're able to plan it better, like it's a medication, for example. So, and the beginning is only starting. This is a great time for the field of exercise oncology, because this is such a vast field to explore. So the future's going to look great with that.
So why is exercise such a vital component in the overall treatment plan, specifically with patients battling cancer?
Yeah, no, no, great question because, at the end of the day, the treatments work. They do the justice. They get rid of the cancer. But as we all know, the treatment-related side effects. Some of them, of course, can be mild, but some of them can be more significant. And I mean, exercise. I mean, of course, exercise, but along with a lot of other complementary approaches, whether it's nutrition, whether it's stress management, all these things. But exercise per se helps to buffer some of these side effects out. So like for example, some of the medications can cause toxicity issues like to the cardiovascular system. But exercise, as you know, helps to keep the heart strong and functioning well. So in a way, when these individuals are going through their treatment regimens, exercise in a way helps to not only slow the decline of the toxic effects that some of these treatments can have, but it can help to promote the recovery afterwards. So it really helps to slow down the bad, in a say, but it helps to promote the good. So that's why exercise, along with other therapies, is vital when a individual's going through their treatment regimen.
So, what's the best approach for building a new fitness plan? Like, should we focus on cardio? Should we be lifting weights? What do you think?
No, that's a great question too. Really, there's really not a perfect answer for that because every cancer is different. Everybody's experiencing their cancer in a different way. Every cancer and just the individual just exclude like by themselves away from the cancer responds to exercise differently. So in a simple answer, if it's feasible to include a variety of different types of exercises all together, that's the best way to go. But for some people, maybe they can't do aerobic, they can't do strength training, but maybe they can do aerobic training. So it really comes back to what the goal is for the individual. If they're trying to lose weight, or if they're trying to gain weight, or if they're just trying to mentally to feel better. But just kind of like a fruit basket. I like to compare it to a fruit basket. Like when you eat a fruit, like a grape in comparison to an orange, you're going to get specific nutrients and minerals from each of those fruits. I like to think of exercise as the same way. So it's best to get a variety of different exercise modalities as opposed to one. But as they always say, something is always better than nothing.
Well, I think that's where partnering with someone with your background and expertise is helpful because you can help decipher I'm in pain because I've not been active and I'm increasing my activity, or I'm in pain because I'm doing something wrong or something is being damaged, right? So it's a balance of finding out what those feelings are telling you.
Absolutely, absolutely.
So, thinking about cancer patients in particular who are managing side effects, and we know that those side effects can vary depending on the type of treatment. So, how can individuals increase their physical activity when they are managing things like nausea, vomiting, diarrhea, etc.?
I get this question a lot, and even to this day, when it like a lot of people when they think of exercise, there's really two sides of the coin, or even physical activity. There's of course this one aspect of it where you're not getting enough physical activity, but then there's another aspect of it where you have so much sedentary behavior. They're synonymous together, but they're still different. And I'll give you an example. They've actually done some studies looking at like bankers or people who work like a 9 to 5 job, like your weekend warriors. They still get enough exercise throughout the week. Like kind of like the weekend warriors, but they're working in their desk job, 9 to 5, so they're sitting for long periods of long periods of activity, but they're very, very fit. because they like, for example, they do like these high intensity HIIT workouts, CrossFit type of workouts. Very, very fit, very, very strong. But but when these individuals, for example, when they had their biomarkers measured, whether it's heart rate, their triglycerides, their fasting blood glucose, their levels were still elevated because of the abundance amount of like sedentary behavior that they had. So what I tell people, if exercise is either not an option for somebody feeling, for example, profound effects like from their treatment, or if they just mentally don't want to do it, I try to get them to focus, for example, okay, if we can't do any type of activity right now, what can we do to cut down on the sedentary behavior? So sedentary behavior is being completely inactive, being in this lethargic, torpor state where you're not functioning at all for long periods of time. You're usually like that when you're either in bed all day or in a chair, or if you're functioning at a MET level less than 1.5, and a MET level of 1 is what we're utilizing at rest. So if we're able to cut down the long periods, that's a great start. The more time that we cut out the sedentary behavior, even if it just means getting out of a chair for like 10 seconds, if we cut those long periods of sedentary behavior periods out, it's going to make the physical activity portion and even the exercise portion much easier. And I know I say physical activity and exercise, I mean, they're obviously almost the same thing, but physical activity as being generalized random movement that produces caloric expenditure, but exercise is being more of a structured, goal focused activity consistent with physical activity. So it's obviously the next level up from it. But by cutting out the sedentary behavior and getting consistent with that, it's going to make it much easier to get active.
Okay, great. So starting slow and kind of building up over time.
Mhm.
So we just have a few minutes left in this episode. So what advice would you give our listeners who are ready? They're ready to increase their physical activity, they're ready to start an exercise program, but they're not quite sure where to start.
No, I mean, great question. Again, I get that all the time too. Is again, depending on what the goal and what they're wanting out of it, or what they're trying to do at the end of the day. Of course, start slow, set a SMART goal, whether it's specific, measurable, attainable, timely, and darn, I can't remember what the R is off of the top. Oh, realistic. So like setting simple SMART goals that works for the individual. Even if it's this like microdosing, like for example, that's another a hot topic area where you're just doing an activity for a very short period of time, even if it's like 10 seconds or 30 seconds. Those micro periods, you stack them throughout the day. It makes it easier. Like for example, I watched this. Not to go on a tangent here, but I listened to this podcast from Arnold Schwarzenegger that was talking about longevity and mortality by doing. He was talking about a study of doing doing 40 push-ups a day is basically a good sign of cardiovascular health. But what he was talking about, and this is where the microdosing comes in, is you don't have to do 40 push-ups all at once. Maybe just break it up, for example. So like maybe you just do 5 in the morning, 5 in the next hour, but then it's like at the end of the day, you do a total of 40. It still counts. And basically where I'm getting at, that can be like something like that. It doesn't have to be push-ups. It can be jumping jacks. It can be even going up the stairs, doing like micro periods of some activity is a great way to start so that when it comes to doing the actual workout of something, or if it means going for a 30-minute walk, or if it means doing that group exercise class or whatever that is, those type of activities are going to become much easier because the body has been adjusted better doing these high frequency amounts of short periods of doing physical activity. So it's like all the pieces adds up to one big period of exercise. Sorry if that was a mouthful there.
No, that was great. I love it. And I love, and we talk about that too as dietitians that, when we say these exercise recommendations or eating recommendations, you don't have to
Mhm.
be perfect on day one, right? We're all human. We all need to build and grow. And the more you do tomorrow versus today, the better you'll be in the future.
Right, and you actually bring up another, even another great point, and this goes great for our cancer survivors. At the end of the day, we may have this great program, we may have the motivation, maybe high 10 out of a 10, ready to get active, or I'm able to do this plan, I can definitely do this, feeling great. But in reality, there may be a day or two, it just doesn't happen. I always tell my patients, for example, look, kind of like what you just said there, you don't have to be perfect, but if you always set the intention, like I'm gonna try to do this, it still counts. It's still you're making the time, you're still making the adjustment in your brain because that's where it starts from there to make the choice, to make the decision of exhibiting that behavior. So there may be days where you just can't do exercise. You just can't do that. You can't get out of it. It's perfectly fine. It's perfectly fine because just as long as you set the intention that okay, I'm gonna do it, but if I don't do it, I'm gonna try to do it tomorrow. Live to fight another day.
Yeah, I love it. That's so great. Well, Chris, thank you so much for taking time out of your practice and out of your day to talk with us today.
Absolutely. Thank you so much again for having me.
And listeners, to learn more about FU Cancer and how you can gain access to our exercise video library, please visit our website at fucancer.health and be sure to like and follow the FU podcast wherever you listen to your favorite podcast. Until next time, I'm Christina Rollins. Thanks for listening.